Hello, this video will explain some things you should know about valley fever. Let's get started. What is valley fever? Valley fever is the common name for coccidioidomycosis, or cocci for short. Cocci is an infection in the lungs. It is caused by a fungus that grows in the soil in Arizona, the southern and central parts of California, and portions of New Mexico, Texas, Nevada, Utah, and Washington. Valley fever is also found in parts of Mexico, Central and South America. Who can get it? Anyone who lives or visits areas where the fungus grows in the soil can get valley fever. People may be at a higher risk if they work or spend time outdoors in affected areas, especially when soils are being moved or dug up. Animals such as dogs and horses, as well as wild animals, can also get valley fever. How is it spread? Valley fever is spread by breathing in spores of the fungus. The spores are carried in dust by the wind when the soil is moved or dug up. Valley fever is not spread between people or animals. You cannot get it from another person who has valley fever. What are the symptoms? Most people have no symptoms. Those who do have symptoms can have them for weeks, months, or even years, and may include the following: cough, fever, fatigue or exhaustion, a rash, chest pain, night sweats, joint pain, muscle aches, headaches, weight loss, and lack of appetite. How is it diagnosed? Valley fever can be confused with many other diseases, including cancer and tuberculosis. A blood test is available to help detect the disease. Keep in mind that a first test may be negative, even if a person has valley fever, since it can take time for the body to make the antibodies that the test relies on. Additional tests are often needed. How is it treated? Most people with valley fever get better without treatment. Antifungal medication may be used if weight loss and night sweats continue, the infection grows, or the person with valley fever is unable to perform daily tasks. In rare cases, surgery may be needed. It is important to note that antibiotics will not treat valley fever and should be avoided unless prescribed by a doctor. Can it be prevented? There's no way to prevent valley fever at this time. Anyone living or visiting areas where the fungus lives can breathe in the spores. Avoiding dust and blowing dirt of desert soils is helpful, but it is not certain to prevent infection. Learn about the disease and tell your friends and family. If you, your family, or your friends have a cough that doesn't go away, a fever, and are feeling tired, see a doctor and ask them to test for valley fever. But remember, most people who get valley fever will have a very mild illness or no illness at all, and will never know they have it. For more information, go to the following websites. Thank you for watching.